And now is the time for us to learn a little bit more from the folks who you just spent quite a bit of time with, those of you who are with your Category A national organizations. We're going to have the Category Bs come up first, and I'm going to invite Cheryl Welbeck, who's going to speak for DPHE. She is a project director of the CDC National Implementation Dissemination Grants at the Directors of Health Promotion and Education. And so, Cheryl.
Okay, great. Good afternoon, everyone. I'm Cheryl Welbeck. I'm the project director for DHPE, which is Directors of Health Promotion and Education. And I'd like to provide an overview of our organization and some of the work that we do. Directors of Health Promotion and Education is a public health membership association. The organization was founded in 1946. Which means that this year we are celebrating 70 years of service in public health. We are an ASTO affiliate, which means that we collaborate with other affiliates to promote policy systems and environmental changes and approaches to health prevention and health equity. Our membership structure is such that we have one voting member for each state and territory or indigenous nation. We also have several other types of memberships. Those are listed on the slide here for folks who share the mission and vision of the organization. So this slide shows our strategic focus. The vision of the organization is to advance health policy and systems change with the health equity focus. And how do we do that? We provide a forum for our members to network and support each other. We advocate for health promotion and health equity in public health. And we provide policy systems and environment training and technical assistance both to our members and to others as well. We have two primary focus areas. As you can see, there are 4 programs which fall under each of the 2 areas. The first area is policy systems and environment training and technical assistance. There are 4 programs there, one of which is the National Implementation and Dissemination Program, and also a health equity focus area, and there are 4 programs under that focus area. I'll provide some additional detail about some of these programs in the next few minutes. Our organization has about 8 full-time staff members and 2 part-time members, or 2 part-time employees. Our co-principal investigators for this particular project are Dr. Susan Geckler and Dr. Steve Owens, our Chief Executive Officer and Director of Health Equity, respectively. Additionally, we have Tameta Kozart, who is our Communications Manager, LaQuisa Haynes-Smith, our Training Manager, and myself. This highlights some of the strengths of the organization. Of course, I've talked a little bit about a good deal of our work which focuses on PSC approaches, particularly training and technical assistance. We also have staff with a lot of expertise, including health equity, program planning, evaluation, online learning, communications, nutrition, community and clinical linkages, and also meeting planning and facilitation. We've got strong IT support systems and platforms. You'll see from the next few slides that we've got quite a bit of web-based tools, some of which you all will be using on this initiative. And we've got an extensive professional network. Many of our members, particularly our voting members, work in state health agencies, and they've got a lot of experience supporting communities doing public health work at the community level as well. Let's take a closer look at DHPE's programs. One of our biggest programs under the Policy Systems and Environment Training and TA area is our Systems Change for Health program, which is a 6-part skills-based training program. It recognizes that health problems are either influenced by policies and environments that support and sustain healthy behaviors, or they fail to support them. We first piloted the Systems Change for Health program in 2006, and in 2009, Directors of Health Promotion and Education decided to begin training a cadre of trainers who could deliver more trainings to scale up some of the work that we've been doing. We do have, I know there are folks here from all across the country, but we do have some upcoming trainings in communities where some of you all are located. So to get more information about the SCH program, I encourage you to check out our table and also to talk with staff in between breaks or at the reception later on this afternoon or this evening. Some of our trainings are taking place in Wichita, Kansas, Indianapolis, Madison, Wisconsin, Crystal City, Virginia, Ashland, and also Columbus, Ohio, and Atlanta. So check with staff if you're interested in some of those opportunities. This is a snapshot of our health equity grant-funded programs. DHPE has an internship program that provides, I'm sorry, guys. We've got an internship program that provides 12-week placements for students from minority-serving institutions focused on preventing heart disease, increasing physical activity, and promoting proper nutrition. The program helps to create a highly qualified, diverse public health workforce to recruit and retain minorities in public health education, and also provides leadership, services, and better health outcomes for communities. Our lupus education program, which is a relatively new program, is working to improve Healthy People 2020 outcomes and support of African American women and their families by promoting lupus awareness, education, diagnosis, and of course treatment among allied health professionals, students, and public health professionals. And under our Community Disparities Analysis program, DHPE has worked with 16 states and completed analysis related to heart disease, built environments to engage in physical activity, also nutrition analysis related to access to healthy fruits and vegetables, food deserts, and under tobacco prevention, analysis of vendors, smokers' characteristics, and also quitline use. There are some sample reports on DHPE's website, if some of you all are interested in those. This is a snapshot of some of our health equity tools. We've got a full toolkit on DHPE's website, which is www.dhpe.org. And they include a policy scan tool, a checklist, and also a patient engagement resource tool. So just to provide a quick overview, the streets in this graphic kind of represent some of the avenues that DHPE uses to achieve its goals. We've conducted over 300 systems change for health trainings in 41 states. Around the country, we've reached over 8,000 public health professionals. Our reach includes CDC staff and project officers, but it also includes healthy community grantees and pitch grantees in Fulton County and also Kansas. Over 600 interns have completed our health equity internship program with DHPE. There's also a lot of strong integration across DHPE's programs. For example, we've placed interns with Category A subrecipients currently working on this initiative and working on projects to reduce cardiovascular disease risk and health promotion related to nutrition and physical activity. And our relatively new LEAP program, the Lupus Awareness Program, has provided funding for 10 health agencies to reduce lupus disparities in 8 states, and so far we've reached over 300 people through our new awareness webinar series. So DHPE is looking forward to working with all of you and your coalitions on the National Implementation Initiative. This is basically a statement of what DHPE's goal and mission is on this particular initiative. It's two-part, one of which provides training in TA, but also communication support for programmatic efforts. These are the types of capacity-building activities that DHPE does on the implementation project. They include training, technical assistance, tools and resource, and also communications. Some of you are probably already familiar with some of the tools and trainings that DHPE has put together. You all have had a chance to take a look at our online group, which serves as a, I'm running out of time here, repository for tools on this project, resource directory, and of course the online course that most of you took before coming here. Okay. That concludes my presentation. This is DHPE's contact information. Thank you all.